Mask up. I'm Adrienne Pedersen. Today on Upfront, the growing number of mask mandates. Is this what it will take to get coronavirus under control? I'll ask Milwaukee County's Director of Emergency Medical Services. That's coming up next on Upfront. Plus, Madison's mayor facing a possible recall.
This is a small group of conservative right-wing folks who are trying to divide our community.
Mayor Satya Rhodes Conway on repairing riot damage in the city and rebuilding trust with the community. And coronavirus cancellations, the economic and emotional toll of the summer that should have been.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Thank you for joining us. We begin with the coronavirus crisis. Wisconsin and the country hit new one-day highs for COVID-19 cases. Yesterday, Wisconsin reported 926 new cases in a single day, shattering the record set the day before. The country also reported its largest increase in cases with more than 67,000 Friday. Some Wisconsin communities are now going to require people to wear masks in public. Milwaukee's Common Council will vote on the mask mandate tomorrow. Governor Evers is requiring masks for state employees starting tomorrow, and returning UW students will have to wear them indoors on campus. Today, we have a little bit of good news in the COVID-19 fight. A Milwaukee doctor says we'll get past this and life will return to normal. Dr. Ben Weston is Director of Emergency Medical Services for Milwaukee County, and he's joining us now on Upfront. You know, Doctor, I think that's what people have all been waiting for, is when can we get back to normal? So what do you think the end of this pandemic looks like here?
Yeah, I mean, it's definitely a question on everybody's mind, myself included. I'll tell you first off, anybody who gives you a definitive answer to this is putting you on, because nobody knows. No matter how much of an expert you are, it's hard to know when we'll be done. But we will be done at some point. Hopefully that'll be through a vaccine. It's many months away, but there's an end.
And you foresee us being able to gather in crowds once again?
I think someday we will. I think there will be lasting changes from this pandemic, as there have been with past pandemics and other, worldwide events. I think probably more people in the future will wear masks than certainly did 6 months ago. I think people will do remote meetings like we're doing right now, more than they certainly did 6 months ago. So I think there will be changes, but I think we can get back to a relative state of normal. But it's going to be some time.
And one thing I think is really interesting, I've been reading a lot about lately, is the reproduction rate. And I read that Wisconsin is the second in the country for the reproduction rate, which means one positive case infects other people. So could you explain why Wisconsin is on this list, do you think?
Yeah, so the reproductive number is an interesting statistic. The thing that's nice about it is it's pretty easy to understand. So if the reproductive number is 1, that means one person on average passes it to one other person. So the number, the burden of disease stays steady. If that's below 1, burden of disease is going down. If it's greater than 1, then you're having increased transmission. And recently, Wisconsin has been higher up in that reproductive number. Now, the tricky thing about the reproductive number is, just like case counts, it does take testing into account. And so as case counts go up, the reproductive number goes up. I think one of the key numbers to look at is percent positive. So of all the tests done, what percentage of them are resulting positive? And we have seen Wisconsin ticking up. We've seen other states ticking up. We're definitely seeing national trends that are very concerning from that number and from really the reproductive number as well.
So the number of deaths has been going down here locally, but there's a recent higher number of coronavirus cases. Do you attribute that to something aside from more testing?
I do. I absolutely do. So the deaths are always a tricky number. So when we look at deaths, when we look at hospitalizations, we know that those are lagging indicators. So somebody first gets, they first get infected with COVID. A few days later, they may get symptomatic. A few days later, if they get sicker, they're going to be hospitalized. You might be 2-3 weeks into their disease at this point. And then, of course, if they, go in an unfortunate direction, then maybe a week later, they may pass away. And so they're indicators that take weeks to catch up. Now, that's complicated as well by the fact that we're seeing younger populations affected by COVID-19 now. And so whereas we saw people in their 50s on average in March, the average age so far in July has been 34 years old. So with this younger population, we know they're less likely to get sick, they're less likely to get hospitalized, And so it means those indicators are even more lagging. But we also know young people don't live in isolation. They interact with their families, they interact with their coworkers, their neighbors. And a lot of those folks aren't young. They're not as healthy. And so they may have complications from COVID-19, including hospitalization and unfortunately including death.
We've seen some other states getting more concerned about overcrowding in hospitals, which is something we talked about at the beginning of the pandemic. Do you think we need to be concerned about that again here locally?
I mean, honestly, I think everybody across the country should be concerned about hospitalizations. So we see in certain states, we see in Arizona, we see in Texas, we see in Florida, we see in California, hospitals getting close to the point of capacity, and some of them at the point of capacity. That's something we were worried about quite a bit in the beginning of the pandemic when we were expecting the surge. I think we did a great job in Milwaukee County, a great job in the state of Wisconsin of physical distancing and of being careful so that we didn't see that surge that we had initially anticipated. But there's no reason to think it's not going to come back. We look all around the country and we see the country going in the wrong direction. And there's no reason to think that's not going to happen to Wisconsin. We're seeing signs of it starting to happen in Wisconsin. Now, that said, I think we're really well positioned. I think we've put together a consortium of the hospitals. They're working together like never before.
With more mask mandates happening in our state, should we expect to see that have a direct effect on numbers of cases?
I think we should. I think mask mandates and physical distancing are two of the most important things the public can do to curb the spread of disease. And so physical distancing involves how many people you're interacting with, what kind of space you're interacting with. Are you outdoors? Are you indoors? Are you close? Are you distanced? And it's also time. How much are you interacting with somebody? You know, passing somebody on a path in the park is pretty low risk. Sitting next to somebody in a restaurant for an hour is much higher risk. And then masks are an essential part of that equation. And so we've seen study after study coming out showing that masks decrease that droplet spread, the droplets that we all release from our mouth every time we talk, every time we breathe, and certainly every time we cough, that contain thousands, if not millions, of virus particles.
Well, Dr. Weston, thank you, and please pass along our appreciation to the medical community.
Yeah, of course. Thank you for your time and your attention.
Thank you. Coming up, Madison Mayor Satya Rhodes Conway. She's facing a possible recall effort after rioting in the city shattered downtown businesses. I'll ask her how concerned she is about it. That's next. And later, Milwaukee's lost summer.
It's heartbreaking for our businesses.
Adding up the losses of the region's major COVID canceled events.